back, viewers. Today, we're delving into a common yet often unsettling occurrence: epistaxis, more commonly known as nosebleeds. Epistaxis is the medical term for bleeding from the blood vessels in the nose. While usually mild and not life-threatening, nosebleeds can sometimes be persistent and severe. Nosebleeds are categorized as anterior, originating from the front of the nose, and more common, or posterior, originating from an artery in the back of the nose, and less common but more severe. Several factors can predispose individuals to nosebleeds, including trauma, nasal infections, sinus issues, mucosal irritation, allergies, hormonal changes, and even alcohol abuse or certain medications. The primary symptom of epistaxis is bleeding from the nostril, typically from one side. Heavy bleeding may lead to dizziness, fainting, and weakness due to excessive blood loss. Diagnosis involves a physical examination to detect the source of bleeding. In severe cases, blood tests may be conducted to assess blood loss. Medical history is also crucial to identify underlying causes. Mild nosebleeds that have stopped may not require treatment. For visible blood vessels, chemical cauterization may be performed. In severe cases, nasal packing may be necessary to stop bleeding. Thank you for joining us to learn about epistaxis. Remember, most nosebleeds are manageable, but seek medical attention if bleeding is severe or persistent. Don't forget to like, share, and subscribe for more informative content.